Then coming to the blood transfusion. Why we should know about the blood grouping? Ideally, during an emergency, what will happen if the person is deficiently blood or he is losing so much of blood? We have to transfuse the blood. And for some emergency surgeries or to be performed, we transfer the blood when the volume is low also. So the blood transfusion is one thing that is constantly done in many fields of medicine. And the concept of universal donor, previously what they said, the person who is having O negative means he is not having any antigens. A antigen is also absent, B antigen is also absent, Rh antigen is also absent. So these persons can be universally donating. And in a similar manner, the universal recipient concept, that is AB positive, like he has all the antigens in him already. So if you put new blood also, he is already having the antigens. So there should not be any issue. But this concept of universal donor and universal recipient is no more valid. Why? Because now we have an extensive system of identifying the blood group and having a good amount of blood bank samples. So that is the reason why this concept is abolished. And one more reason is that there are many other antigens also other than this RBC antigens, other than this OABO and RH antigens. There are around 120 antigens present on the RBCs. So we will try to match as much as possible. For example, a O positive person should always donate to a O positive person, like that. We try to match it as much as possible. So before transfusion, what should you do? First thing that we have to do is the blood group should be matched. Otherwise, we don't do it at all. First, we have matched the blood group. It doesn't stop there. When you go inside a blood bank and see, they will do one more step, which is called as cross matching. This is also a very, very crucial step. We have matched the blood groups, but that doesn't mean that the particular blood sample will not cause any kind of injury or any kind of reaction in the recipient. So they always do my major and minor cross matching. So first coming to the major cross matching. Major cross matching, what they used to do is they take the donor RBCs, donor RBC. Suppose some donor is there and he is giving me blood. They take the donor RBCs and they will take my plasma. They will take my plasma. That is recipient plasma is taken. They will cross match and see whether there is any reaction. Why this is called major cross matching? Because just in case this recipient plasma has some antibodies against this donor RBC, what will happen? Whatever donor RBC is entering my blood, everything will be destroyed. So it will cause a very serious damage to the recipient. So that's why this is called as major cross matching, because the donor RBC is coming in small quantity and there is a huge amount of plasma in me which might have an antibody against it. Usually it doesn't have whenever we cross match and see. Suppose just in case if it has, what will happen? It will destroy all the incoming RBCs and there will be a severe allergic reactions and cross reactions in the recipient. That's why it is called major cross matching. Now coming to the minor cross matching. Minor cross matching, what do? The reverse. They will take the donor plasma and cross match it with the RBC of the recipient. Why this is called minor? Obviously, it should create some minor reactions. That is why it is called as minor. In this, the donor plasma, even though if it has antibodies, for example, it has antibodies, it will obviously go and attack the recipient RBC. But the recipient has huge amount of plasma. There is a huge amount of plasma in the recipient. So what will happen? This donor plasma is very little, like around 150 to 200 ml only the plasma will be there. Whenever this plasma is entering into the plasma of the subject, which is around 3.5 liters, what will happen? All these antibodies will get diluted. And the amount of destruction caused on the RBC is very, very little, very, very minor. That's why this is called as minor cross matching. But in a cross matching is done, both this should be negative. Like there should not be major cross matching defect also, there should not be minor cross matching effects also. Then only it will be transfused into the subject. Minor means it doesn't that minor cross matching there is some reaction, we just give it to the subject. It's not like that. Both are important. It is named major because it will cause us a major defects will be there when this is done. It is called minor because the effects by the donor plasma on RBC will be little in comparison to the other side. Now coming to the RH incompatibility. So before blood is cross match, we are doing this thing. But there is one important incompatibility which happens between the mother and the fetus. That is called as RH incompatibility. So what happens here? Usually the ABO-RH incompatibility does not happen. Suppose if the mother is A group and the father is B group and the child is born with a B group. So what will happen? There is not much of major cross-matching issues. Why? Because of the IgM. The ABO system is having the IgM immunoglobulins. This IgM does not cross the placenta. If it is not crossing the placenta, obviously it cannot affect the fetus. So there is no problem in the ABO system. But coming to the RH system, it has to be, it creates a problem. Why it creates a problem? Because it is an IgG. It is made up of IgG immunoglobulins which can cross the placenta. So whenever there is crossing over happens in the placenta, it can lead to some dangerous disease in the fetus. That is why this RH system is important. Even before matching the astrology, my suggestion would be to match this blood group at least before, so that there is no severe reactions in the mother and the baby. So what happens? Let's try to understand the situation. So first thing is, this reaction happens whenever the baby is positive and the mother is negative. This does not happen in any other cases. If the father is positive, then there are chances that the baby might be positive and the mother is negative now. So during the first pregnancy, what will happen? During the first pregnancy, this intermixing between the mother and the fetus does not usually happen, because we have one wonderful separation. What is that? Placenta. This placenta keeps the mother and the baby separated from each other. But during the delivery time, what can happen? There is some fetal admixture of blood. There is some feto-maternal admixture of blood. The fetal blood is entering the maternal circulation and maternal blood is entering the fetal circulation. So now the baby is RH positive. The baby is RH positive. The baby's RH positive blood is entering the mother. The mother has been RH negative through her entire life. Now what will happen? The mother will sense these as the foreign agent. So what the mother will do? The mother will start producing antibodies. Now this antibodies will cross the placenta and it can attack the fetus. So it will attack the fetal RBCs. Even during the first pregnancy, there can be minor reactions which is happening in the fetal RBCs because of the antibodies that is formed in the mother. So at least in the first pregnancy, there will not be any serious complications, because it is happening only during the time of delivery. But before that, if there is any maternal fetal mismatch, then also there will be severe injury to the fetus. But the second pregnancy in that female is very, very dangerous. Why? Because now whatever antigens from the baby has entered the mother's side, what will happen? They will form something called as the memory cells. Memory cells means now their body is capable of producing more and more RH antibodies whenever anything positive enters. So they will form the memory cells. Just in case in the second pregnancy also the mother is conceiving a positive baby, the mother is negative and she is having a positive baby. But at this time, now the mother has memory cells. So if there is very little minute admixture of blood between the fetus and the mother, what will happen? There will be RH positive cells, antigens entering into the mother. The mother is having memory cells. Now the mother will produce tremendous amount of antibodies. The cells are triggered and the mother will produce tremendous amount of antibodies. These antibodies will attack the fetal RBCs like anything. They will try to destroy all the RBCs in the fetus. That is why this disease is called as erythroblastosis fetalis. It is literally destroying the baby. There is a milder form for this. There is a severe form for this. This mild form is called as icterus neonatorum. Icterus neonatorum. Why it is called icterus neonatorum? The reason is very simple. Because the attacked RBCs, what they will do? The RBC, whenever the destruction happen, they will increase the bilirubin. That is a byproduct of RBC, and this bilirubin will cause the jaundice. And the sign is called as the icterus. That's why this is called as icterus neonatorum. But sometimes it will destroy the entire baby itself and forms a severe form that is called as hydrops fetalis. eye drops fetalis. So what is the prevention? Can it be prevented? Yes, it can be prevented. Prevention can happen right before marriage also. But if the conception has happened and the mother is negative and the baby is positive, what we can do? Immediately after the delivery, whenever she delivers it, we will try to give anti-D antibodies. Anti-D antibodies. These are the antibodies against the antigens. So what can happen? Whichever Rh antigen has entered the mother, what will happen? They will be destroyed immediately. So there is no chances of forming the memory cells. Memory cells is the huge issue here. If we prevent the memory cells from forming, then we can prevent the second baby from getting affected. So we will give 2 doses of this anti-D antibodies 24 hours apart immediately after the delivery has happened. So it destroys the mother's antibodies and prevents the it destroys the mother's antibodies to be formed. Like before it's formed, it is destroying all the antigens that is available, and it prevents the formation of memory cells. So the memory cell formation is prevented here, finally preventing the second baby. So this is the best treatment for erythroblastosis fetalis.